If you have pain in the front of your hip, it's very likely that it may be coming from your hip flexors. But do you have tight hip flexors or do you have a hip flexor strain? And should you stretch or strengthen your hip flexors? I'll answer all of those questions in this video, plus give you treatment tips for either case. But first off, how do you know whether you have tight hip flexors or a strained or lengthened hip flexor? Well, first we're going to do a hip flexor length test. And to do that, the textbook way to do that is to sit on the edge of a bed like this, to lie back on your back, bringing both knees up to your chest, then hold one tight so that your lower back stays flat on the bed while lowering the other one down. And your legs should fall all the way down flat towards the bed. So as you can see, I have tight hip flexors, and then you test the other side like this. Now, if you have difficulty getting into that position, you can also do a modified version of that where you lie close to the side of the bed and you pull one knee up to your chest and let the other one hang off the side. And you use the same criteria. Your thigh should fall flat towards the bed. And then obviously you'd have to sit up and turn around to do it on the opposite side. Pull one knee up towards your chest and let the other one dangle off. Now, if your leg doesn't fall all the way flat down to the bed, then it's likely that you have tight hip flexors. So the solution for tight hip flexors is stretching your hip flexors. In many cases, the test can become the treatment. So if your hip flexors are tight in the test, just hanging your leg off the side of the bed like this is actually a great way to treat the problem. Then you just hold this position for about a minute. Now, if this gets too tiring, or in many cases, if you have lower back pain as well, as the hip flexors pull down, they can pull you into a back arch, and that becomes uncomfortable. There are some other options. This one is actually my favorite way to stretch the hip flexors, but some people do have difficulty with this version. For this one, you'll kneel on the ground, or you can kneel on a bed as long as you're not close to the edge and won't fall off. And you want to roll your pelvis underneath of you like this, kind of roll the pelvis underneath so it keeps your lower back flat, much like it was on the mattress. And then you push your hips underneath of you like this. Now, one mistake that many people make when doing a hip flexor stretch like this is they'll go into a lot more hip extension, allowing their back to arch. But because the hip flexors or iliopsoas attaches to the front of your spine, this doesn't stretch it if you allow your lower back to arch. So you have to tuck the pelvis underneath, tighten your abdominals, keep your spine in a neutral position, and then squeeze your glutes to push your hips forward, and you get a nice stretch in the front of the hip flexors. Now, if you can't do this because you have too much pain kneeling on your knee, you can also do a modified version sitting in a chair. You can also do a hip flexor stretch in a seated position. And this is very much like the kneeling version, except you don't have to put weight on your knee. To do this, you'll scoot to the side of the chair and let this leg drop off the side of the chair. Then try to do a pelvic tilt, roll your hips underneath of you, and push forwards here until you feel a stretch in the front of this leg. To see that from the side, we'll turn the chair, do it on the other leg here. You scoot to the side, let this leg drop off behind you, tuck your pelvis underneath, push your hips forward, and you should feel a stretch right in the front of the hip or the front of the thigh. Now, how do you tell if you have a lengthened or weak hip flexor? Well, true hip flexor strains usually happen during sports or athletic activities where you quickly contract your hip flexors. However, you can also get a lengthened hip flexor if you have weak glutes and you go into too much hip extension. If your leg falls way down this way, the head of your femur can glide forward and bump into the hip flexor tendon, which can cause pain when you're going into too much hip extension. And so one treatment for a hip flexor strain is actually strengthening the glutes so it pulls the head of the femur backward in the socket. We'll get to that in just a moment. But first, how do you strengthen a lengthened hip flexor? Well, you want to bring it into a shortened position which means bringing your knee up towards your chest as far as you can. Now pull it up as far as you can with your hands and then let go and try to hold it there. And try to hold that for 10 seconds. Now if you notice that your leg slowly starts to drop there, or maybe suddenly drops when you let go, then it's likely that you have some weak hip flexors. And so again, the test becomes the exercise. Lift your leg up with your hands, hold it there, and then let go with your hands and try to maintain your leg in the same position. If you can't do it on your own, just lightly use your hands underneath your thigh and only give as much support as you need in order to prevent the leg from falling. Lift up and hold for 10 seconds in that position, and then slowly lower, and repeat that for 10 repetitions. And that's to strengthen your hip flexors. Now, I also mentioned that it's a good idea to strengthen your glutes. And whether you have hip flexor pain because of short, stiff, tight hip flexors, or because of lengthened or strained hip flexors, it's very likely that you have weak glutes. If your hip flexors are short and stiff, that means your glutes, particularly your gluteus maximus, is in a lengthened position, and so your glutes become weak. And if you have excessively lengthened hip flexors, it's very likely that you use your hamstrings for hip extension rather than your glutes. So although your hip extension may be strong, it's likely that you're using too much hamstring and not enough glutes. So to strengthen your glutes, we're going to go through 2 exercises in this video, but there are many, many more. The first one we're going to do in a back lying position or supine position like this. You'll do a pelvic tilt to flatten your lower back out on the bed, then squeeze your glutes and lift your bottom up in the air. Now, when many people do a bridge, they lift their bottom up as high as they can, but notice that causes a lot of back arch, which you don't want. So roll your pelvis underneath like this, get your spine in a neutral position, and then only lift as high as you can without allowing your lower back to arch. And then hold this top position for 10 seconds and then lower down. You do have to pay attention to squeezing your glutes, because if you don't, if you use too much hamstrings, especially if you're hamstring dominant, it's likely that you'll get a cramp back here. So do the pelvic tilt, squeeze the glutes, use the glutes, and try to use only the glutes as best as possible to lift your pelvis up off the table. Hold for 10 seconds and then lower back down. And again, repeat that 10 times. This both strengthens your glutes as well as you'll notice it stretches your hip flexors if you have tight hip flexors. And even if you have over lengthened hip flexors, it draws the ball of the femur or the head of the femur back into the socket, so it's not bumping out into the hip flexor tendons as you go into hip extension. Now, another exercise is just the reverse of that, and that's going to be lying on your belly going into hip extension. When your knee is straight like this, you can use both your hamstrings and your glutes to go into hip extension. But when you bend your knee like this, it takes your hamstrings out of the movement because they're on slack, and now you have to only use your glutes. So squeeze your glutes, then do a slight lift, again, not causing back arch. So you may notice that you may not be able to lift the knee very high or maybe not at all off the surface of the bed. But that's okay. Just do what you can. Squeeze your glutes, tighten your glutes, push your hips down into the table, and then try to lift the knee slightly off the table if you can. And particularly if you have tight hip flexors, this is going to be very, very hard to do. Now, one thing with both of those glute strengthening exercises is they're both lying down. And that's not the way that we use our glutes in everyday life, but it is a good start, especially if you need to learn how to turn your glutes on. But eventually you want to move into weight-bearing glute strengthening exercises, which are really the most functional, best way to strengthen your glutes. To learn how to strengthen your glutes in weight-bearing positions, check out this video over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.